Hello and thanks for joining us for Eye on New Mexico. As we've been telling you this week, April is Child Abuse Prevention Month, and all this month we'll be focusing attention on that issue on this program. I'm joined today by Cece Miranda, sitting next to me, a retired APD commander. Also Dr. Renee Ornelas from UNM Hospital, a child abuse pediatrician. And we also have Christina Ford from All Faiths, which is a resource for children and families here in Albuquerque. What do they all have in common? Well, they're all now a part of the Albuquerque Mayor's Child Abuse Prevention Task Force. And we're going to talk about that in a moment. Of course, the child abuse crisis came to the forefront earlier this year because of this boy's story. 9-year-old Omari Varela, police say his mother kicked him to death in December. And in the months that followed, we learned of really this little boy's tragic life, a history of abuse in the family, and several reports to police about it, but nothing was done in time to save him. The goal now, of course, is to make sure we don't let other children fall through the cracks. Tuesday night, Albuquerque's new task force held its first public meeting on this issue. Our Erica Zuko has a look at that.
Little Emma Rose Gonzalez was the light of her grandma's life.
She loved butterflies, she loved birds. She just loved life. She was a very, very happy baby. Happy.
But police say at just 22 months old, she was violently killed by her mother's boyfriend.
This was the only time he had ever watched Emma. He was never with her alone before this night. And I left for work and I never saw her again. Sorry.
Tracy Martin says her family never saw signs of abuse in the year her family knew that man, but she feels there was still a lost chance at prevention.
Education is the key. Had we been educated, had we done a background check on this person, we would have found out a lot, and she would have never, ever, ever spent 1 second around him.
She hopes the new city task force helps the public get education and seals the cracks between different agencies. Victims like 9-year-old Omari Varela slipped through. His mother is charged with kicking him to death. Tonight, panelists from that task force held their first of several public forums. They want the community to weigh in on what they think would help improve the current system.
The meeting's driving the focus areas through the input from the community.
They'll take those ideas and work out the details in working group sessions. Tracy Martin knows no task force will bring Emma Rose back.
When she died, a part of us died with her.
But she hopes it will save other children who still have a chance.
Such sad stories that we've been hearing in the media, and all three of you have experience seeing these stories firsthand. Cece, we saw you there in Erica's story there. You were with APD for a long time, and now you're heading up this task force. Tell us a little bit about what you saw during your experience and what you're bringing now to the task force.
You know, when I worked in child abuse, we were co-located with CYFD. I think that made a huge difference because we had access to the CYFD investigators. So oftentimes we would be able to alert them of cases right as we got the calls. And I think when we moved out of the same building, it caused a barrier in communication. I really think that's what happened. Recently, I think that the steps to improve communication are going to go through. They're going to proceed. I'm really glad to hear that the CYFD workers will co-locate again with APD and the Family Advocacy Center. I think that's wonderful. I think that's going to solve a lot of what has gone on in the past.
Yeah, that was a big part of what came out of that story and the meetings or this announcement that CYFD will kind of work in-house with APD again. And that was the issue that came to the forefront after Omari's death, was the idea that police were there, they responded to these calls. CYFD didn't know about it. Did police tell them about it? Who knew what and when? And this is going to change that, you're saying?
It is. The other issue is, you know, technology is great, but technology changed the way that we report things to each other, and we weren't tracking cases back and forth. And I think that the case brought that to focus as well. And I know for a fact that we're working on getting better data from CYFD and tracking the cases back and forth through the process, more follow-up. That definitely has to happen.
Has it already started to happen?
Absolutely.
I know you're...
Yes, it has. I mean, the chief has already implemented changes to the standard operating procedures. For the police officers, training has already taken place. They've been very aggressive at the police department in getting a lot of these issues resolved.
As a former police officer, you know, I can imagine that police officers see these cases, and then sometimes when you hear later what has happened, they feel so terrible for not doing more. You know, I can't speak for them, but have you seen that happen, where in hindsight you wish you had done something, or an officer wishes they had done something?
You know, absolutely. I don't think any police officer, or we can expect any police officer to know what the final or end result of any one case is going to be. I know that police officers, you know, do the best they can, and I really think that with training, maybe perhaps a little bit more training in response has to happen, especially at the field level. Like our detectives at Crimes Against Children Unit do an awesome job, and they get praise. Everybody that I've talked to, they get a lot of praise about the work that they do. You know, being a child abuse detective is a hard thing.
Oh, sure.
I mean, you know, they see those cases in and day out, and I think that I've done some research with what other departments are doing, and they actually have debriefings, and they actually have resources for officers experiencing. I mean, some of these cases are very traumatic, even to us as police officers. So I think more needs to be done in that respect. The turnover of police detectives in that unit, I haven't had a chance to really delve into that, but I remember when I was there, it's a hard place to work. You're not going to stay there for 2 years, and if you do, your heart's really in it. And what I've learned is most of the detectives that are there in APD and even in BCSO have left and gone back as supervisors, and that's really, that's amazing to me.
Yeah,
That's dedication.
Yeah, and we know with CYFD it's the same thing. These social workers, it's hard to keep people doing that very difficult job. Dr. Ornelas, you're coming to the task force from a physician's perspective, of course, and sadly you see cases every day of child abuse. You know, what was your hope getting involved in this task force?
Well, my hope has been that bringing everybody together, everybody who does this work on the front line, all the responders, people who do the investigations, people who provide advocacy services, people like myself and Dr. Strickler who do child abuse medical services, can put our heads together and work on getting a response for children with concerns of abuse and neglect, the best kind of response that we can get. And certainly there's a lot of people who really care about the work that they do. Everybody who's in this work is in it because they have a dedication to it. Otherwise you wouldn't continue to do this kind of work. But at the same time, we need to work together more efficiently so that we can come together and get the best result.
I imagine from the medical field, that's where a lot of reports are generated. Sometimes doctors like yourself would be the first people, or some of the first people to see cases of child abuse. Is that first of all, I should ask, are doctors required to report when there are suspicions of child abuse?
Everybody is required to report. Everybody, there used to be language in the law that said that certain groups of people who worked with children were what was considered mandated reporters. But nowadays, I mean, now the laws have been changed so that everybody's a mandated reporter. And it's not about calling the babysitter to confirm whether or not the child was there or what happened. It's about reporting if you have a suspicion of abuse. That's all it, and it's not our job to do an investigation. There's investigators that do that kind of work. And so we do our work, and when we come across this, you're supposed to report, and there's Pound Safe if you live in Albuquerque, and there's a child abuse hotline. You can call 242-COPS. I don't know the number right off the top of my head for BCSO, but either one of those agencies are first-line responders to concerns of child abuse and neglect.
Well, you took me to my next point, which was great, that anyone can report suspicion of abuse. You don't have to be a quote-unquote expert in a field like yourself or a police officer or something like that. And that's what this task force is encouraging people to do, is report when you see something.
Anybody should report. That's the thing. The whole community has a responsibility in this. And what I hope is that more people come to the community meetings that we're having and give us their ideas, tell us what it's like to see these kinds of situations in their home, in their family, in the neighborhood, put our heads together and come up with a better way to do things.
Christina, from your perspective, you work with a group, All Faiths, head up a group that that kind of works with families and children, sort of strengthening the families. There have been some questions out there as to whether there's too much of an attempt these days in society to keep children with their parents, to keep them with their families. And we know that people, want to keep families together. But what are you seeing from your perspective? And are there some changes that need to be made with how we do that?
Well, All Faiths is a behavioral health agency, so we run a lot of therapy programs, case management. We work with families in their own homes. We also tie into the child abuse investigation process through our Safe House program, which is a forensic interview program where we see nowadays over 1,000 children a year.
Wow.
So there's a huge increase, and we have seen this increase over the last few years very steadily. We do work with families, and through that work we do see how hard it is to work this system of mental health services.
Yes.
So definitely my expertise is, All Faiths' expertise in this realm is what we like to bring to the task force is to talk about systemic issues. And what is it as we as society and we here in the state can do to better our systems, to work not only with the children who have been traumatized, but also their families. Very often we see that families need support. Parents are dealing with their own issues, past abuse that they never dealt with, substance abuse, mental health issues that are not addressed because of lack of services or lack of access to services.
That's a great point, and mental health is such an issue that's a huge issue in this community that we've been talking about as well lately. But so many cases of child abuse clearly come from a family that's dysfunctional and not a healthy family.
Correct, correct. And there are numerous stress factors that families have. Indigent families have huge problems, poverty issues, as I said, substance abuse, mental health. So there are many points where we can touch a family's life, where we can make a difference, both from a nonprofit's perspective, helping out with certain services, but also I think from the state's perspective, making sure that families get the access and get attention when they need it. And they don't always need the same kind of attention. They need individualized care often, and there currently is just no way to gauge all that need.
One of the things the task force is doing is identifying some things that can be done right away. You're talking about systemic changes, some of them that will take much greater efforts to change, but some things that can be done right away. And when we come back, we're going to talk a little bit more about what that task force will be focusing on from right now. We'll be back in just a moment. Thank you for staying with us. As part of Child Abuse Prevention Month, we're focusing in on this program this month on how we keep our kids safe here in New Mexico. Last Wednesday, the governor announced some sweeping changes in the way child abuse is investigated here. Jen Samp has the story.
I committed soon after Omarie's death to a personal review of not only the details of CYFD's interaction with the family and his family.
Governor Martinez wants to close the communication gap between caseworkers and law enforcement. For starters, CYFD caseworkers won't be allowed to close a case until they review police reports. 2 contacts with CYFD and the case goes to a high-level review team. Parents we talked to say such steps should have been taken a long time ago.
I definitely think they need to have more open communications with area police, no matter where they're at.
I think it's ludicrous that, there's families out there that abuse children and get away with it.
For too long, people have kind of turned a blind eye and figured, oh, it's not my problem, it's not my business, I shouldn't get involved.
In addition, the governor is introducing a pilot program in Bernalillo County. Family support workers will work with families who have 3 or more investigations in the past 10 years. In Valencia County, identified as a place where kids are at high risk, a new family advocacy center will soon be opening. Law enforcement is also working on a database so that officers can look at a family's history with CYFD online in hopes no more families fall through the cracks.
Omarie died in a manner that no child should ever experience. He was betrayed by the one person who should have loved him and protected him the most, and that was his mother.
Some big changes. The governor also announcing she wants to raise pay for caseworkers, even the starting salaries, and make the pay higher for staffers willing to work in rural areas. So obviously trying to keep quality case managers and social workers on board, but also some big policy changes. And Christina, you wanted to talk about that a little. This is a step in the right direction.
It definitely is, and we are very much applauding Secretary Dynas and the governor for making these changes happen and implementing all these new steps in order to investigate better and to have greater attention to these issues. I also think that nonprofits like All Faiths need to be part of the solution as well. So we are working closely with CYFD on collaborating on these issues, so we can also turn our attention also toward prevention, not just after the fact when something happened. So I think that government agencies and nonprofits have to come together to provide services before tragedies happen.
Yeah, absolutely. And it's encouraging to see some things happening right away, some things we can implement right away to potentially stem this problem. I know Dr. Ornelas, at the first meeting of the Child Abuse Prevention Task Force the other evening, you talked about access to daycare even, something that we could potentially expand right now that might help a lot of families. Tell us about that.
Well, one of the things that we lack in New Mexico that is an easy, quick step to making children safe is quality daycare. We don't spend enough money as a community and as a state on providing quality daycare. And who ends up taking care of children when you're poor is who's ever at home. And that's not necessarily the best person to take care of the children. And daycare is also a great checkpoint. If you had professionals that were trained in child development and in recognizing the signs and symptoms of child abuse, you would have people who every day would see those children and would notice if something was going on in that family, if somebody was hurting that child. In my mind, it's an easy fix, but it's not something that you are immediately going to see the effects of. It's something that we have to invest in and believe that eventually will come to an outcome that will benefit children.
But it's a great point that we should, as a society, see that as a priority of who's taking care of kids all day, and until they're school age, and then of course even then after school. There's so many of us parents who have to leave our kids with someone else during the day, and I can certainly relate to that. And it's horrible to think that we saw the grandmother who her granddaughter had to be left with someone who just obviously wasn't the right person to take care of her.
Exactly. And that's what we can address with a little bit of time and effort and money to put towards qualifying, certifying daycares and people who provide daycare, not just the people. CYFD has a program where they certify certain centers and certain people for daycare, but expanding that so that everybody would have access to those kinds of services, because this problem isn't just in poor families. It really, although I may have said that initially, it's across the board in all families, and everybody would benefit from this.
While you're on that topic, I did want to ask, you make a great point. This issue affects all families. Of course, poverty must be a risk factor. Are there trends you tend to see in your practice of families that are vulnerable to child abuse?
Yes. Domestic violence is huge. You can't, we focus on the adult victims of domestic violence, but research has shown that children are also the victims of direct domestic violence, but also just the observation of this kind of violence in their home affects them quite severely. And it affects, you can imagine what it would be like to watch the person that you love hurt. And even in a child's mind, they can come to think that this person might die as a result of what they see happening in front of them, and how terrifying that might be. Here's the person who's protecting you, who loves you, takes care of you, and something can happen to them, and who would you be left with? The person that might be perpetrating the violence. So domestic violence is a huge problem. Substance abuse is a huge problem also, and there are not enough services to address the issues that we have in New Mexico around substance abuse. And it's a huge factor in the lives of children, because while their caretakers are under the influence, nobody's watching them, and they're vulnerable. The people who are under the influence can hurt them, and the people in the environment can see that that child is now vulnerable, nobody's watching out for them, they now have direct access to that child.
Again, showing why this task force is bringing together experts in all these areas, people who know about domestic violence, people who know about drug abuse, all need to be a part of this, because that all comes back to child abuse. Cece, you mentioned schools. I mean,
Yes,
clearly that's a
yes,
key
schools.
element to this as well.
Yeah, exactly. I wanted to bring a point up about that age group, 1 to 4, the most vulnerable, and the daycare, like you said, the daycare would be a stopgap point for these children, because data, not just in New Mexico, but everywhere in the entire country, shows that that's the most vulnerable age group. Why is that? Because they're at home. Nobody may have access to them, okay? Schools, aside from being at home with their families, children spend the most time in school.
Sure,
So I think schools are definitely going to be a part of helping us with these solutions, and I look forward to them possibly being on the expert panel for the next meeting.
Let's talk about that. The whole community really is invited to get involved with this, to come listen at the meetings, to bring their perspectives. May will be the next meeting for the Child Abuse Prevention Task Force.
Yes, we've tentatively set it for May 1st. Let's not forget, I mean, this is a police public issue. This falls right in line with community policing, which is about involving the community, partnering with the community, and bringing them in to help us resolve this, because this isn't just a police problem. This affects everybody. It's our responsibilities as adults in the community. I don't care where you work, if you're a business owner, it doesn't matter. You have to be part of the solution and help your community.
Well, you're absolutely right. In Omari Varela's case, you know, a lot of attention came onto those police officers who responded to the call that they released the lapel camera video of that call. But we also heard later there had been an incident at a store. Of course, Omari also went to school and after-school care. So there were a lot of people along the way that could have noticed something, and besides those officers who were in that video.
Absolutely. And that brings up a good point, because on some of those responses, the officers did everything they could. They did what they were supposed to do, and it still, for some reason, wasn't enough. So the follow-through and the follow-up, I think, is critical. The communication, the sharing of information is really going to make a huge difference.
Is this task force something that's really groundbreaking? Dr. Ornelas, you said that you're taking the model from other places where this is working, but is this kind of the first time we're seeing something like this here in Albuquerque?
No, I think we've seen problems like this all along. I've been here for 25 years, and there are cases like Omari who, you know, these severe cases of physical abuse where they repeatedly came into the system, whether it was through law enforcement or CYFD or even the schools. But the problem is that people don't trust their basic instincts that tell them something's wrong. And so what I would encourage folks to do is trust that feeling that you have that something's not right here, and bring professionals and investigators, you know, by reporting it, attention to that. And then you'd be surprised. You open the door and there's a lot behind it. And when you do, what we see sometimes is just the tip of the iceberg, and we don't see what that child's going through at home, or what they're going through when they're left alone with a certain caretaker. And the only way we're ever going to get into that arena and get to know what's happening in the other parts of that child's life is if we bring in professional help. And I think people are concerned that they don't know enough and that they don't have the whole story, and they want to give people the benefit of the doubt. But in the middle of this is a child that's growing up in that environment. And I hope we make mistakes, and I hope we call too many titimes and report too many cases, and then we find out that nothing's there and nothing happened. I don't think that's going to be true for a lot of the cases that report. I think we will find out that there is something else going on with those kids.
And of course, you know, as Christina, you've seen too, you know, if you leave a child in these situations, they grow up to repeat the cycle, and the mental health aspect and the effects of that are huge.
Definitely. I mean, we see that in reoccurring basis that we are interviewing children who are now the children of those who we interviewed 20 years ago, and they didn't get the necessary services, so it repeats itself. As far as the task force goes, there are other task forces in our community who are working with early childhood and other issues, but the mayor's task force is unique in a way that it brings real good and very strong community attention to this issue, and I think it really will enable us as a city to talk about the issues, look at what we can do, and then hopefully take it to a broader level, a larger level, statewide, and see what other changes we can make to the systems to make it work better for the children.
Yeah, absolutely. I mean, this is unique to Albuquerque right now, but we know this problem extends throughout the state, clearly, the problem of child abuse. Well, I want to thank our panelists here today, Christina Ford with All Faiths, Dr. Renee Ornelas from UNM Hospital, and CeCe Miranda, a former APD officer, a commander, all of you bringing such great expertise to this child abuse prevention task force now. And like I said, we're going to keep this issue at the forefront of this program all through this month. So hopefully we'll be able to have you guys back maybe in a few months even and see that there's some progress being made with this issue. And again, tentatively May 1st, another community meeting. We'll keep you updated on that and let you know how you can get involved in this fight and effort as well. Keep it right here for Eyewitness News 4 coming up next, and we will see you back here next Sunday for another Eye on New Mexico.